AMD, or macular degeneration, is a disease that affects a person's central vision. It usually happens in people who are 50 years or older. There are two types of AMD. About 90% of the people who develop AMD have the dry form, in which vision deteriorates slowly or not at all. The other 10% of people have the wet form of AMD. Many people who develop wet AMD suffer from severe vision loss in 2 to 3 years. Dr. Busquets explains.
Macular degeneration begins when the central portion of the retina, the macula, begins to deteriorate. In the dry form of macular degeneration, a yellow material begins to collect beneath the retina. This yellow material accumulates in tiny spots called drusen. At this point, patients may become aware of blurring of their central vision. People who have dry macular degeneration may experience a gradual loss of visual details. In the wet form of macular degeneration, abnormal blood vessels grow under the retina. These vessels may bleed, causing a central blind spot or distortion of the central vision. You may be given a tool known as the Macular grid to monitor for these visual changes. If your doctor suspects AMD, you may need an additional test called a fluorescein angiogram. This test is very useful in determining whether you have the wet or dry form of the disease. The doctor can determine which parts of the macula are damaged and whether there are abnormal blood vessels to be treated. Macular degeneration can be treated in many ways, and numerous modalities are available due to continuous research being done in this field. PDT, or photodynamic therapy, is a cold laser administered in conjunction with an intravenous light-sensitive drug to halt or slow the progression of abnormal retinal blood vessel growth. This treatment generally does not create a blind spot on the retina. Laser photocoagulation, which is a laser treatment involving the application of a hot laser to seal and halt or slow the progression of the abnormal blood vessels, may produce a blind spot on the retina. In certain cases, we may also recommend intravitreal injections of medications such as Macugen or Kenalog to treat age-related macular degeneration, either alone or in combination with other therapies. There are numerous other conditions that can affect the retina and macula. Some are rare, some are relatively common. These may include wrinkling of the retina or macular pucker, macular holes, and retinal tears or detachments. Retinal tears can usually be fixed with a laser. The other conditions mentioned usually require a type of surgery known as a vitrectomy. Sometimes, after vitrectomy surgery, and depending on the condition being treated, your surgeon may ask you to keep your head in a certain position. Our staff will go over these instructions with you in more detail if you need to have retinal surgery. Regardless of your particular diagnosis, it is important to remember that early detection and treatment can significantly increase the chances of an independent lifestyle.
Patients are examined every 3 months by a doctor to determine if another treatment is necessary. Visudyne causes temporary photosensitivity for 5 days. The Macular grid is a way to test your vision for macular degeneration. Cover one eye and look at the grid. All lines should appear straight.